There were 454 cases of epilepsy in which received the experimental vagal nerve implant as part of the study. Out of that group, there were 13 reported infections, 8 of which responded and cleared with antibiotics, 5 of which, however, did require removal of the implanted material. In addition to that, there were 3 cases of some nerve dysfunction, 2 of them a slight facial weakness on the side of the surgery, and 1 of them a hypersensitivity of the skin, which could be seen after any skin incision. And then there were 3 reported direct vagal nerve injuries, which resulted in hoarseness and vocal cord paralysis, all of which cleared spontaneously over time.
Implantation of the VNS therapy system is typically accomplished in 1 to 2 hours.
I treat the case somewhat like the insertion of a shunt, which most neurosurgeons are very familiar with. Namely, I have all the skin covered with a plastic coating such as Vidrape, which ensures that none of the implantable material will contact the skin prior to insertion. Number 2, I have the nurse not open the packet until I'm actually ready for each piece of the device so that nothing is left lying on the back table. And number 3, I close the wounds with a subcuticular stitch so that there are no suture openings that could conceivably allow ingress of infection. The second major complication I would consider is the possibility of damage to the vagus nerve. This just requires a careful dissection, a good exposure, good lighting, and treating the nerve with respect.
The cosmetic results of this surgery are important, even when the patients come to you saying that they don't care so much about that. The incision on the neck is in a place where it can be seen on a person, and this can always be made to heal well by keeping it in the direction of the normal skin creases of the neck. Similarly, the incision in the axillary region, I have found, heals with much less widening of the incision if it also is in the direction of the creases in the skin, and this is very easily accomplished. The median outcome, the outcome of the person in the middle of the class, will be about a 50% reduction in the frequency of seizures. Patients may also have decrease in the severity of seizures or the length of their seizures, so that some of the benefits may not even be reflected by this number.